Good morning. I'm Dr. Jessica Saepoff. You're listening to Dental MD on 1150 AM KKNW, Alternative Talk. This station is awesome because people like myself and other holistic and alternative-minded people can have a show and tell you everything that we know, which you might not otherwise get to hear about. So this show, Dental MD, is about holistic, alternative, biological, complementary, integrative, whatever word you like, dental care. And that means that, all dentists actually are trained by the mainstream American Dental Association curriculum in every dental school. The licensure is all based on national board exams, clinical exams, all designed and approved by mainstream. So if you're wondering why it is so difficult to find a dentist that's not mainstream, it's because we all have to be trained through the mainstream in order to become dentists in the first place. And that education is a barrier. The education itself is a barrier to the practitioners being open to other ways of doing things. So some holistic practitioners moved in the holistic direction, for various reasons. Sometimes they themselves or a family member had a health problem that wasn't solved adequately by mainstream medicine, and then they start looking at alternatives in medicine and eventually find out that there are alternatives in dentistry as well. And other times, people are they hear about it word of mouth, or they catch wind of it through friends or online, and they are open enough to actually look at it for more than a split second and scroll past. They actually stop and click on something and start learning about other ways to think about healthcare, other ways to think about dental healthcare, oral healthcare. If, there are other practitioners available in medicine that everybody knows, understands, is familiar with, like naturopaths, osteopaths, chiropractors, nurse practitioners that are holistic. There are a lot of ways to get care other than going to a mainstream MD. That's pretty well known to people. There are also homeopathic practitioners, Chinese medicine practitioners, acupuncturists, all kinds of other modalities. And a lot of times people will not avail themselves of that unless their mainstream care attempts are failing or inadequate in some way or unsatisfactory. And then they look at alternatives, but the alternatives are right there in plain view. That is not the case for dental alternatives. It's much more difficult to learn about and find holistic dental practitioners. There is only one kind of dentist, unlike the physicians where there are many different types, and it's only the ADA trained. And those of us who are holistic have taken various amounts, various types, various philosophies of alternative training applied to dentistry. The training is not standardized. There are a lot of different people out there doing continuing education for dentists that is holistic in one way or another. Sometimes it's comprehensive. Sometimes it's single issue focused, like ceramic implants instead of titanium implants, that kind of thing. So today's show is about access to holistic care. How can you find a holistic dental practitioner that suits you? Because you're going to find some that don't use fluoride but still put mercury fillings in. You're going to find some that don't use mercury anymore, still use fluoride, and maybe aren't using safe protocols. They just don't use mercury anymore, but when they drill it out, they're not really applying safeguards. And you'll find others that are applying safeguards that look like they just stepped off of a spaceship. They've got head to toe coverage and they want you sedated and they want you covered head to toe, all of that kind of thing. It's from one extreme to the other with dentistry. So today's show, I'm going to try to give you some guidance to help you learn about what's available in holistic dentistry, so based on what your issues are, what kind of a person, what kind of questions you want to ask to find the practitioner or clinic that is best suited to solve the problems that you're having or answer some questions for you, do some diagnostic work to see what's going on and suggest some treatment options for you that make sense to you, that you can afford, hopefully. So today's show is about helping you to ask the kinds of questions that will lead you to the care that works the best for you. So access to holistic dental care, it's an issue. It's been a frustration for many years. It's not only frustrating for you, the patient, but it's frustrating for practitioners as well, because online, a holistic dental office that's just an individual practice owned and run by a dentist or a couple of dentists, that is a very tiny little entity compared with these gigantic corporate dental entities, which sometimes all of their offices are under the same name, and other times it's a management company and they're doing promotions for all of the offices that they manage. But each one of those offices, if you just called them directly or looked at them, it would look like a small independent practice, but yet they are managed behind the scenes by a large corporate entity. So, they're going to be run like a very efficiency being more important than other things, because the bottom line in a corporation is more important than other things. And by other things, I mean your preferences. If you want something done a particular way and the way that you want it done is outside of their usual routine way of doing it, well, all of a sudden they've got to stop their routine. They have to change how they're doing something. They have to get something or remove something from their usual protocol way of doing it. It's going to take extra time in planning. It's going to take extra time in the procedure. It's an upset in the schedule, becomes unpredictable. They haven't done it that way before. They don't know how long it's going to take. What if they're behind for the next patient? Oh my gosh, being on time is, probably the most important thing all day. Anyway, that's the reason that when you go into a regular office and ask them to do something your way, that you might notice some irritation on the part of the staff or the dentist. And it's not that they, as people, don't want to help you. It's that throws a kink in their type A day. It's not their routine way. And so, it becomes a disruption. So, certain kinds of patients are disruptive to the usual way of doing things. And if you're a holistic-minded person, that's very likely happening in your life when you go into a regular office and then make requests and want things modified to suit you. A lot of offices that really are owned and run by one dentist and not run by a big corporate entity, those small independent practices are, it's easier for them to make those modifications. But a lot of times, those dentists are also still very set in their ways. They've got a way that they want to do everything, and your requests basically represent a disruption to the schedule that costs them money, because time is money. And so they may try to redirect you, re-educate you. They may have you sit down with a treatment coordinator instead of talking to the dentist, because that's less expensive for the office. And then they try to get you, square peg, round hole. They're going to try to round off your corners a little and get you to fit into their practice and the way they do things. Or they may just bump up how much they're charging you too, but usually it doesn't occur to them to do that. The first thing that occurs to them is to try to get you to fit into their way of doing things by, air quotes, educating you. So, yeah. And so when you're asking questions of a dental office, you might want to really find out whether it's a small, independently run. How flexible are they willing to be with you and your requests? If you go into a mainstream office and you ask them to use safety protocols when they drill out your metal, they're not going to have any real clue what that means or what's possible for safety protocols, because it isn't part of their training if they're a routine dental office. If they're holistic, they may have at least heard of some of these things, safety protocols, but I've heard of some dental offices that claim that they're being safe with mercury, for instance, and they'll say, oh, yeah, well, we use dams and we use the high-speed suction. Well, everybody does that. We're trained in dental school to use a dam and a suction, but are they making sure that it's watertight? Are you getting, dust and sludge leaking underneath? Have they cut the top edge of the dam so that your nostrils are facing the dusty, high vapor zone that, that's happening in your mouth while they're drilling stuff out? Or did they give you some way to cover your nose and breathe maybe air from another source so that you're not breathing the dust and vapors coming off of your tooth as your amalgam is being drilled out? There are a lot of things that can be done to make that process safer, and a dam and a suction are not good enough. They can be used in ways that are good, but if all they're doing is, yes, we use a dam and suction, so does everybody. So they're not necessarily making it any safer than how we learned in school. And in school, we learned that, if there's some gray dust down in your mouth, suction it a little bit, rinse it, and then it's okay for you to go ahead and swallow the whatever residue is there, which is awful, but that's how we're trained. So anyway, we're coming up on a break. I just want to tell you again, you're listening to Dental MD Radio Show. I'm Dr. Jessica Saepoff. I'm going to take a break. Today I'm talking about access to holistic dental care, and I will be right back after this break.
My life has been a tapestry of rich and royal hue, an everlasting vision.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD Radio Show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
NHL star Matt Martin for American Humane.
Hi, I'm Matt Martin, and in all my years of playing professional hockey, I've gotten my share of bruises and injuries. But for many who really put their lives on the line every day, it's not always the injuries you can see that hurt the most. I'm talking about our veterans. Every single day, 184 veterans are diagnosed with post-traumatic stress, and tragically, 20 take their own lives. When medications and therapy don't help, professionally trained service dogs can. American Humane, serving the U.S. military for over 100 years, has put together a free guide to help veterans obtain these life-saving service animals. If you are a veteran or know a veteran struggling with PTS, please go to AmericanHumane.org for this free, downloadable resource. Let's give our veterans the help they need to win their battle.
For more information, visit AmericanHumane.org.
An alternative to everything else on your radio dial. Alternative Talk 1150.
Once amid the soft silver sadness in the sky, there came a man of fortune, a drifter passing by.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about access to holistic dental care. What some of the hurdles are, why it's so difficult to find a practitioner, what some of the pitfalls are, even if you find somebody that advertises or promotes themselves as alternative. Let's talk about going on the internet to do a search. So what you want to find, right, is the closest office to where you live. You want to know whether they accept your insurance, and you just, you have either certain problems or questions, or you just want to get established. You have no problems, but you're due for a checkup and a cleaning and maybe some, update x-rays, and you just want to get established with a new dentist in your area, but you want one that's more holistically minded. Well, there are certain questions that you can ask into your internet search to find something appropriate for what you're looking for. And very simple, if you keep it simple, if you said, mercury-free or no mercury, that's not a good search. It's nice and simple, but it's not really a good search. You really need the word safe in there somewhere. Mercury safe, or safe mercury, or safe with mercury, dentist that is safe with mercury, whatever safety protocols, whatever way you want to state that, try a few different ways, because I'm sure you've been online, of course, and you know that how you ask the question changes what your results are. So ask a few different ways, and you'll get different results. And you might even get, in your results, you might get the names of some organizations that train dentists to do safer mercury removal or other holistic ways of doing things. Go ahead and take a look at some of those organizations, because they have membership lists, and you're going to find a member that's nearby. You're going to be able to click on that and go to their office website and have a look and see whether it's a good match for you. There's an old joke that goes like this: what is the definition of an expert? Well, it has to be at least 50 miles away, and it can't be a family member. So, don't fall into the trap of feeling like you're going to have to travel a long way to get to a dentist that's good. I mean, yes, that's historically been true. There's always some truth in these things. And just like, those of us who want to eat organic food or non-GMO food, we are ready to drive not only across town, but to a different town, to go to a grocery store or a co-op that has the food we're looking for, even though there are 6 grocery stores within a mile of your house. So it's just like that with finding any kind of holistic care or products. But that doesn't mean that you won't get lucky and find that there's a dentist right nearby that just happens to be holistic, because that can happen. I have people that come in to the office in Issaquah and they say, I just moved to Issaquah and I can't believe there's a holistic dentist right here in Issaquah. Yes, well, that's the luck that you have. So look around, see if there's one nearby. Yes, you may have to drive a ways to get to the care that you want. You're probably already used to doing that for food and nutrition products, perhaps, and supplements, and perhaps your holistic medical practitioner may not be nearby either. So when you go online and you do a search, try to use some of the words that you know are involved in your particular issue, like wisdom teeth or orthodontics, or you have a TMJ click or pain in your jaw, or you have been told you need a root canal and you want to know if you really need a root canal, or is there something else that can be done? Is there any way to save the nerve? And you want, if you go to if you go to any number of mainstream practitioners, you're basically going to get a very similar answer. And, some of them might be on the root canal question. Some of them might be willing to just sort of wait and see. And if your tooth gets worse, then come in, that kind of thing. But most of them don't have a lot of other options to offer you. So whatever your issue is, put in words to that effect: root canal, old metal fillings, mercury fillings, old crowns, plastic, danger of plastic filling materials. Some are better than others. For filling materials, there are different kinds of plastics, and there are also ceramic. Now, some people will say porcelain, and they mean any tooth-colored restoration. So there's a lot of misinformation and confusion. Porcelain is ceramic. Porcelain is a type of ceramic. Stoneware is a type of ceramic. Anyway, ceramic means that it's been baked in an oven and it's made from sand, basically. Anyway, but porcelain is a very high quality. There are some other things included in it for dental uses, and it's very beautiful, very hard, polishable, doesn't change shape or size after being bonded to your tooth, and doesn't off-gas at all, ever. And the cements used can also be non-plastic. However, for things that are very small, you might want to have a plastic filling, which is composite, also known as resin. And glass ionomer falls into that category, even though it's not technically a resin. There are a lot of glass ionomers that have resin mixed in, but it's under the category of tooth-colored filling. So that usually, if it says filling, that's referring to filling materials, not onlays and crowns or inlays for that matter. Even though it's filling a hole, it's not called a filling. So there's a lot of confusion about terms. So I'm just kind of breezing through that real quick for you. But getting back to plastics, some plastics are, that you use in your everyday life. Some of them are recyclable, some of them are not. Some of them have, they've got different codes on them. Some of them are safe to use for food storage. Some are not safe to use for food storage. Some can go in your microwave, some can't. Some will melt in your dishwasher, some won't. So there are a lot of different types of plastics, and they're not all the same. And that's the same with dental materials that use plastics. Some are pretty good and not that toxic. And none of the plastics are perfect, but they're, you try to get one that doesn't have BPA or other cytotoxic or enzyme disrupting chemicals that off-gas out of the fillings into your system and cause havoc with your health. But they're not perfect. They're not perfect. And one of the things that the mainstream has done is they have really ginned that one up. Well, you want to remove your mercury fillings? Plastics are also toxic. Well, yes, but mercury is like more toxic than lead, and the only thing more toxic than mercury is radioactive. So that's pretty high up on the scale. So just saying that, it's like a false equivalence. Oh, well, plastics are bad too, out of the frying pan and into the fire, But there really is a difference, and there are plastics that are better than others. So there's really more to that than that sort of surface a little too easy comparison between mercury fillings and plastic fillings. All right, well, we're going to be coming up on a break here again in a couple of minutes, and I want to give you some information about how to contact us. In the next segment, I'm going to talk more about how to do searches and what kinds of questions to ask when you do call an office. Our office, located in Issaquah, we're easy to find. We're just off I-90 between exit 15 and 17, and so you could take either one of those exits. And the phone number there is 425-427-8899, and you can also reach us by email, appointments@naturaldentist.com. You can email questions, and my staff will make an effort to give you the best answers they possibly can, including bringing your questions to me so that I can give them guidance on, how to answer you, and then they'll get back to you. And what we want is for you to decide through asking questions and figure out whether our office is the right place for you. Now, in the next segment of this show, I'm going to talk about what kinds of questions to ask to get kind of to the bottom of things and see whether that office is the right one for you, and maybe how to start in the first visit or two to make sure that you're in the right place. All right. I'm Dr. Jessica Saepoff. You're listening to Dental MD, and I'll be right back after this break.
I feel the earth move under my feet. I feel the sky tumbling down. I feel my heart.
I'm Dr. Anthony Lizowitz, and this is Climate Connections. In West Virginia and other areas of central Appalachia, coal mining has turned the tops of formerly green mountains into rocky plateaus.
You have compacted, rocky, invasive species infested land.
That's Nathan Hall. He once worked as an underground coal miner. Now, he's president of Reclaim Appalachia, an organization working to convert former mine land into low-cost, usable farmland.
Central Appalachia has almost no viable farmland.
At a pilot site in Mingo County, West Virginia, goats, chickens, and hogs are rotated through 6 acres of land. The animals eat the invasive plants, and their manure adds nutrients to the ground. Then, heavy machinery churns the compacted earth and pulverizes rock to make the ground suitable for planting. The goal is to grow specialty crops like berries, nuts, and herbs, and raise meat and eggs. Hall says that reviving this depleted land can provide a new, sustainable industry for the region he loves.
It's kind of hard to explain just how intrinsic these mountains and this landscape is to your being. It's the only place that I'm really comfortable in, and I think I can make an impact here.
Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Having trouble picking up the Alternative Talk 1150 signal? Well, whether you live in Portugal or Puyallup, Tasmania or Tacoma, India or Issaquah, you can get Alternative Talk 1150 programming streamed live on your computer via our website, 1150kknw.com. It's true, just visit 1150kknw.com and click on the Listen Live button. Make sure you have an audio player installed that will play streaming MP3 audio such as Winamp, iTunes, or current versions of Real Player or Windows Player. Visit our website for more details. Remember, that's 1150kknw.com.
Seattle, Tacoma, Antwerp? That's right. We're streamed worldwide on our app and on the web at 1150kknw.com.
You're around, ooh baby, when I see your face, mellow as the month of May. Oh,
Welcome back. I'm Dr. Jessica Saepoff. You're listening to Dental MD. And today I'm talking about access to holistic dental care. And some of the words that you will want to use in your search, like I said in a previous segment here, use different kinds of words. Try different phrases when you're doing your search. Some of the terms that will bring up the most comprehensively holistic dental offices are integrative, biological, holistic, natural. Alternative is good, but it's not, I don't know if that's as good of a term as integrative right now online. But try different things. It changes all the time. So you're going to use those kinds of words, and some of what you will get in your search are independent, individual dental offices, and other things you will get are offices. Well, with holistic searches, you're not likely to get dental offices that are run by or managed by large corporate structures, because unless they've got these search terms, in their search engine optimization to try to catch some of the air quotes health conscious consumers, unless they're doing that, they're not going to usually come up in a search for holistic natural practitioners. But the other thing that you might get are some organizations that have memberships, large, well, not very large, but bigger membership lists. And so you'll be able to find somebody in your area if you go into their website, click on them, go in their website and look at their membership list and see if there's anyone in your local area that's a member. And then you have to call individual offices and get a sense of what their priorities are. If they're like a regular office, but they sell some nutrition products, that's probably not going to be adequate. If you are looking to have, probably the most common thing is that people want metal replaced. Sometimes people want old root canals removed. That's harder to find dentists that are aware or know how to do that in the way that holistic dentists are trained to do it, or it's just a little less common knowledge among practitioners. And the replacement options are also going to vary from one dentist to another. Some will try, if you were missing a tooth, that's another common question. I'm missing a tooth. I want a holistic dentist. I want to know what my options are. Because the mainstream is very high pressure, high sales on implants. They will act like an implant is your only good option and all other options are second rate, and okay, I guess if you can't afford an implant or you're not educated enough to understand that an implant's your best thing, then I guess you'll have to settle for a partial, they really have an attitude about all other dental work besides what they do that they make the most money doing. There's been a big sales job done on dentists about implants. It's not completely their fault. It's how we're trained. But if you don't want an implant, then you want to go to somebody that isn't going to treat you like you're some, hick that doesn't know any better, and so you might as well get a denture. That's not acceptable. A partial denture or a removable tooth that is well made of biocompatible materials, and you're the only one that knows that that's what you've got, and and you can always do an implant in the future. This is like a space maintainer. It completes your smile, and it keeps your other teeth from drifting and shifting. It's a wonderful solution, and if you use it for 2 years or 10 years, that's your choice. And we're going to be able to regrow teeth. I don't know when they're going to give us that technology and let us start doing that for people. It's been in research phase for 10 years or more, but I believe we're going to have that technology. And if you don't want an implant, you want another solution in the meantime until regrowing teeth is made available to all of us, then a partial is a good option. But if you go into a mainstream office, they're not going to be able to grok most of what I just said. And so you want to go to an office where they've heard of these things. That's a start, right? So ask your questions. When you call an office, you want to ask questions any way that you want to, any way that's natural for you. Don't try to make your questions seem, knowledgeable or smart, or, don't worry about that. Ask your questions as organically, your way, and then see what kind of a response you get. Are they patient? Do they give you good, choices? Do they help you understand the terms you're using in your questions so that you sort of fine tune your questions so that they can really give you the best answer? Or do they just give you like quick answers and immediately try to get you to schedule an appointment? That's, you don't want to feel rushed. You don't want to just have them sort of brush over your questions. Really make sure, especially if you're going to be driving an hour or more to get to their office, make sure that that's the right office for you. Really look at their website, look for inconsistencies or clues that they might or might not be on the same wavelength, have enough of a similarity in philosophy to what you believe about health. Because even if you're not a professional healthcare provider, the consumer knows about health. You know when you feel good. You know when you have energy. You know how you feel when you're around people who are rushing you and not respecting you. That's part of health. That affects your health. And you want to be in an environment where you're respected, where your time is valued, where your questions and your concerns are important. In our office, that's the most important thing, because you, as my patient, I want you to be choosing as we go, moment by moment, at choice with what we're doing. So I continually check in with you and make sure that you understand what we're doing, know what we're doing, agree to what we're doing for you. We're not doing anything to you. We're doing it with you and for you. And I want you to feel like that's how it is the whole time you're there. And if that means that the procedure takes longer or we divide it into 2 different visits, then that's what we do. And I'm, adamant about that, because that is how I keep your stress level down, and that's how I keep the office happy and running smoothly and everybody feeling like we're being of service and not struggling to get, something from you as a patient so that our day can be, meet our goal or whatever it is. That's never entering my mind when I'm sitting with you and we're figuring out how we're going to best be of service for you based on what you want, and we help you to kind of get to the bottom of what it is you want done and what your preferences are or what your needs are, and then we tailor your treatment to that and make sure that you feel like, that that's what's being done for you the whole time that you're there in every visit. And that's just my way of doing everything. That you're not always going to find that feeling in every office. Sometimes you just want your mercury removed safely, and you may not personally like the dentist, but if you feel safe, like it's being done safely, and you feel confident in them as a clinician, practitioner, and they have good reputation, and that's fine too. You don't have to love the dentist or the staff or anything. I don't mean to imply that that's, of paramount importance. It isn't necessarily. It is for some people, but depending on what is important to you, and if you don't really see eye to eye with the practitioner on certain things, but you do on the thing that they're doing for you, well, that's what you want to get to the bottom of and find out, and then you'll know that that's where you want to go. So it can be frustrating. Sometimes you have to try out different offices. You might go for just a specific exam rather than a complete total exam, or you might do a complete exam just to see like how they evaluate every area of your mouth, your gums, your jaw, posture, everything, nutrition status, knowledge base. There's a lot of stuff that goes into that new patient exam, and during that exam, they're learning, the dental office and the dentist is learning about you, but you're also learning about them. How much are they telling you during the exam, or are they going to have you come back, they keep everything super quiet during the exam and then say, okay, schedule an appointment for a treatment, what's the word, to present the treatment plan for you and explain everything to you. And they won't even show you your x-rays or anything on that day. when you come in for that special visit, sometimes you'll be led into a beautiful office that looks like more like a lawyer than a dentist, and there's a computer screen, and they've got your x-rays up there really big and big photos of your teeth, and they're going to go through tooth by tooth and tell you everything that they feel that you need, and here, just sign on the bottom line and start making your appointments, see the treatment coordinator and appointment desk. Well, that style of treatment plan presentation, that's how a lot of dentists are trained to do it, and that works well for some people, especially these big cosmetic offices usually do it that way. So you can, get a sense of the comprehensive plan for you, for your smile. But that isn't necessarily the only way to do it. Of course, it isn't the only way to do it. And just, be aware that there are these different styles of telling you what's needed. When I do an exam, I tell the patient as we go what I'm finding, what I see, maybe a little brief introduction to what some of their choices might be, and, whether we need more data, another diagnostic test or this or that. And by the time you're done with your new patient exam with me, you've got a really good idea of what was found, what your choices are, whether you really need something done, whether you can wait on that or this, and the things that you had concerns about, are those high priorities compared with other things I found. And you're going to have a pretty good picture, and you don't have to remember everything because we'll go over it every single visit if you like. We'll just sit down and just kind of review what the plan is, or, what the findings were, and go over your choices again, because you're not going to absorb everything on that first day. But you will get a sense of, reassurance about the issues and, whether you can take your time making a decision, or whether something's a little more important, or, a little more precarious, shall we say. So that's my style of doing it. And if that suits you, then that's, you want to find an office that does things like that. It's just the way I kind of evolved doing it. All right, and we're heading into a break. Let me tell you again how to contact our office. And we're not the only holistic dental office in the area. We're not the only one that does certain things, but we are the only one that does certain things. Not everybody sees kids. Not everybody's latex-free, et cetera, et cetera. And, of course, my way of doing everything is how I've developed it. And if that suits you, then you'll want to come and see me for treatment or exams and options. All right, so you can give us a call, 425-427-8899, or you can reach the front desk by email, appointments@naturaldentist.com. Ask all your questions, figure out if that's the right place for you. We'd love to see you. We're always welcoming new patients. All right, you're listening to Dental MD. I'm Dr. Jessica Saepoff, and I'll be right back after this break.
Way over yonder is a place that I know, where I can find shelter.
Honey, isn't it amazing?
What?
The sacrifice, the dedication, the grit. I mean, they really set an example, don't they?
Oh, well, no question. Today's high school athletes are truly special.
Not the athletes.
Well, who?
The officials.
Oh.
Today's student athletes are truly special. But there's something pretty great about the men and women who officiate their games, too. Like the way they're giving back to their communities. Officiating is a terrific way to stay in shape, meet new people, and stay connected to the game you love. But the biggest reason of all? We need more qualified high school officials here in Washington. And without them, the rest of us would have a whole lot less to cheer about. High school games need officials. High school sports need you.
Great call, Ralph!
Yeah!
Interested in becoming a licensed high school official? Go to highschoolofficials.com to learn more and begin the application process.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Tell your friends about Alternative Talk 1150.
From a hunger and cold, and the sweet tasting good life.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Now, I've been doing this show for about 7 years now, and if you go to 1150kknw.com, you can go into Dental MD radio show and see all of the archives. There are shows on all different topics within dentistry, as well as some general shows about comparing mainstream and holistic and alternative dentistry. And so go in, take your pick, have a look, see if there's a show that's on a topic that you've got questions about, and get some information. You'll be better able to ask. One of the reasons I do this show is to help you form better questions. You hear something new, a question arises in your mind. That is a new question, which brings you new information. Just like when you go online and you ask things in different ways and you get different search results, just forming a question in your mind makes an impression on, if you are into this esoteric science, it makes an impression that on whatever, the ethers, whatever the ethereal realm, and causes an impression that will bring back to you into your path the answers to your questions. And that's how the law of attraction really works. Just, you can be intentional, or you can just sort of organically have questions arising in your mind. And if they are important questions to you, you're going to have an emotional charge on those. If it's something you really want the answer to, that sends out a fairly strong impression out from you. And if you're paying attention, then as the answers start to roll in, and sometimes that's fast and sometimes it's several days or a month, and the answers will come across your path and they will stand out because they're a match for the question that you have. And just like as you're looking at books on a shelf, there will be a book that just kind of stands out. Oh, what's that? Oh, that looks interesting. And, I refer to that as a book jumping off the shelf at me because it's something that's a match for something I was interested in or asked about in my mind or out loud. And that's the way information gets back to you if you're paying attention. So I figure if you're listening to a station like this, then you're interested or knowledgeable about law of attraction and how this works. And, it's very interesting. And the more you are aware of it and practice it, the more obvious this process becomes, how it works and that it works. So I do this show so that you can hear information that you might not otherwise hear about, because you're not going to hear a lot of this just walking into a regular dental office. And it allows you to refine questions that you have or ask new questions in your mind. And that way, when you go online and you find offices that seem like they might be a match for what you want done or how you want things done. And you call or email them and you ask them some questions just to see if, that's really where you want to go. Your questions are going to be better developed if you've listened or read up on, your issues. Like you can just do a search on root canals or on mercury, get some information, and then do a search for a dentist. And now you've got some information either by listening to my shows or just doing some reading on your own or going online and looking at information, or of course an old-fashioned library. Those are good too. And now you've got some really well-developed questions that you can ask, and you will get better answers back that are more tuned in with what you're wanting to know. So don't hesitate to ask a lot of questions before you decide whether a dental office is where you want to go. And you might want to go to more than one not for x-rays. You only want to get x-rays once and then take those with you to the next dentist's. Your insurance is probably, if you have insurance, is probably only going to pay for one exam. But if you want second opinions, multiple opinions, then before you decide who you're going to have do dental treatment for you, who is going to numb you and drill old metal out, before you decide who you're going to allow to do that, you want to make sure you're comfortable with the philosophy, the techniques, the training of the dentist that you're going to. The training of holistic dentists really varies by quite a bit. Like I said at the beginning of the show, you are going to find some that don't use fluoride but still use mercury, some that don't use mercury but still want you to have fluoride treatments. Some see kids, some don't. Some do orthodontic treatment. Some use metal brackets and bands still. And others are using exclusively non-metal techniques. Some will do early orthodontics and do expansion and make room for teeth. Others are still recommending waiting until all the permanent teeth are in and then extracting some of them and then straightening. There are every manner of philosophies out there, and you might find a dentist that doesn't use fluoride and safely removes mercury but still does, orthodontics the old-fashioned way, or sends you to orthodontists, doesn't do ortho in that office, and they refer you to someplace that's going to extract teeth and straighten and maybe remove wisdom teeth when actually, if they had been patient, maybe you have room for them or your child has room for those wisdom teeth. So, depending on what the issue is, you're going to find dentists that you agree with on some things and not other things. So it all depends on what you're looking for. Make sure you feel comfortable with that office. If the type of care itself is more important than the personality of the dentist, that's fine. Chairside manner is not important to everybody, but for others, because they've got fear of going to the dentist, who that dentist is and how they're treated and how you're spoken to might be the most important thing. And then you don't even care what they do to fix things, as long as they're nice to you and don't hurt you and speak gently and let you take a restroom break when you need one and don't act impatient with you. And whatever it is that you're looking for, that's what you want to ask your questions about and find out what that office is like before you go. And maybe go to more than one for little exams to get a real idea of what it's going to be like before you have them do any treatment for you or your family. All right, so you have been listening to Dental MD. I'm Dr. Jessica Saepoff, and the way to get a hold of us, if you want to get a second opinion or have a complete exam or have a 3D image, we've got a new X-ray unit that can do a 3D image. We can look at the bone, we can look at roots, we can look at old root canals, we can look at your jaw joint in 3 dimensions. And you only want to have this kind of an X-ray done if you really have an issue or a question because, radiation. So, but we do have it available so that we can look very closely at some of these issues that people have where they're maybe concerned about whether after a wisdom tooth was taken out, did the bone heal well in that area, or is it still kind of unhealed. And there are a lot of, you can go online and ask questions about that too. That's a big issue most people don't even know about. So the way to get a hold of us, if you want to get an exam, get a second opinion, have treatment, is you can call us at 425-427-8899, or you can reach us by email, appointments@naturaldentist.com, and ask all your questions and call up and ask questions and get a sense of who we are, just like you would any dental office, and see whether it's a match. All right. Well, I thank you for listening. I will be back next week. I'm Dr. Jessica Saepoff, and you've been listening to the Dental MD radio show. I'll be back next week.
The views expressed on